United Healthcare members in South Carolina soon could lose access to treatment and doctors at Bon Secours due to a contract dispute.
Taylor Farmer has more on the negotiations and what's at stake.
Bon Secours and United Healthcare have a contract that's set to expire July 1st. Both tell us they're at opposite ends of the bargaining table when it comes to what they will require to continue working with each other. Come July 1st, if an agreement is not reached between Bon Secours and United Healthcare, the two will no longer continue services as part of an in-network option for patients. This would mean if patients still wanted to see their Bon Secours doctor, they could, but under United Healthcare's insurance, prices would come right out of their pocket at a much higher cost. Bon Secours tells us they've been in negotiations since January, and if an agreement is not reached, about 30,000 patients will be impacted. Both companies say the other is asking too much. Bon Secours tells us in part, quote, "We've made repeated efforts to secure a fair agreement that reflects today's healthcare environment, but United Healthcare continues to underpay compared to market standards." Bon Secours says they're working towards an agreement that would allow them to continue providing high-quality care to patients, but United Healthcare says the rate they're asking them to pay them is too high. United Healthcare tells us, quote, "Bon Secours St. Francis is seeking a price increase of nearly 32% for our commercial plans over the next 3 years, along with a substantial rate hike for our Medicare Advantage plans, which would make them the most expensive in our South Carolina network." Through 4 months of negotiations, both companies state they're only looking out for the best interest of their patients. Bon Secours tells us, quote, "We are committed to doing everything possible to avoid any network disruption," but they called out United Healthcare, saying their unwillingness to collaborate to disrupt care for thousands of patients. United Healthcare responded by saying, quote, "Our top priority is to reach an agreement that remains affordable and ensures continued access to the health system. We hope Bon Secours St. Francis shares our commitment and collaborates on solutions that South Carolina families and employers can afford." At this time, it's unclear if either party is willing to come closer to fulfilling what the other is asking of them. Although United Healthcare tells us they proposed an offer to Bon Secours to extend their current contract through July if negotiations are still ongoing, they tell us Bon Secours refused that offer. In Greenville County, Taylor Farmer, 7 News.
As those contract negotiations progress, of course, we'll follow them here and have the very latest on air and at WSPA.com.